For the record, Senator Chris Marr from the 6th Legislative District, I bring you again another good little bill. I want to say, I mean, obviously the area of public health is something we're all concerned about. Senator Fairley, you and I serve on the Healthcare Committee, and we know that we've been undergoing a steady process of underfunding public health, and we are one major epidemic or health crisis away from the public understanding how important it is. Along those lines, I come forward with a bill I think that addresses some concerns that are shared by many of the 400,000 people who are served by the Spokane Regional Health District. I won't suggest to you that there is not some controversy around this. There is definitely, and this definitely has been brought about by the result of a number of controversial issues. There is a political subtext, and that is because, unfortunately, our regional health district has been politicized, intentionally or not, over the last few years. I've handed out to you several articles. The one I would draw your attention to is a one-page editorial endorsement of this bill by the Spokesman Review, which is on February 15th. And in that is a brief overview. I will tell you that there's a lot of history here. We had a chief health officer who had a somewhat stormy 10-year history and then was removed several years back. In 2003, the existing health board stripped all of the citizen non-elected members of their voting rights. Those were restored several years later based on a lot of public outrage over that. And the bottom line, Madam Chair, is today we have been without, for 2.5 years, without a chief public health officer, a qualified individual to operate that department today. It presents tremendous risk. And so that's why I am proposing that the county, or excuse me, the health district would be better served not by a body that was dominated and represented largely by elected officials, but one that represents more of a balance. As was indicated, we are in fact including 2 members of the County Commission. Senator Omig will be introducing, I hope, an amendment which will modify this to address some concerns of the city of Spokane that it did not have representation. So actually, one public member will be left off to keep the board at 9, and the city of Spokane, as the largest city in the district as now, will have a representative. I will tell you, and I don't know how the city of Spokane is weighing in on this, they also suggested that they were not comfortable with 2 regulated industries being represented on this. I will tell you, Madam Chair, I'm much more comfortable having those groups exert their influence inside a process that is subject to public records requests and public observation, rather than, as some would suggest, putting political pressure on the outside. I'll close by saying this bill was brought to me and is endorsed by the State Medical Association, the County Medical Society, the County Dental Society, many health professionals, and overwhelmingly my constituents are saying that this is something that needs to happen, and it needs to happen before we are subjected to a major public health crisis in Spokane County, and I will let others speak to other aspects of the bill.
Thank you.